So hello everyone, welcome to this, I don't know which number we are at, of LTCCovid webinars. Today is going to be quite informal, and the idea is that we're going to, so everybody who wants to speak, raise your hand and I'll try to get to everybody. The aim is to understand a little bit what are the impacts of the Omicron pandemic in your countries. What do you think are the key issues? Quite interested to hear about reflections of lessons that have or haven't been learned from the first wave to this one. And I'm also very interested to hear about key aspects that you think we should be trying to focus when we try to pick certain areas to highlight through the LTCCovid network or key evidence and things. And I just wanted to give you a quick update on the international report. It's growing, and we are now combining more and more a mixture of experiences of countries with emerging evidence that's partly supported through some evidence summaries we're doing through the Social Care Recovery and Resilience study. And many of you are doing some excellent work. And if that's not already on the system, then please let us know and send us short summaries that we can upload quickly. So that plug aside, as I said, what I'm going to do is follow your lead in terms of raising hands, and then I'll be asking people to contribute. I'll try and give people enough warning before then invite you to speak so that you don't get caught by surprise. If you have slides you'd like to share, you're very welcome to do so. I think one or two people have sent them, but I'd rather you share them yourself if you can. No more than 2 or 3 slides, by the way, because otherwise it may take a bit too long per country. But we can also think whether we want to have some further webinars soon. We have, in fact, we will probably have one on Australia at a different time on the 14th of February, but I'm very happy to also have more webinars if you all think that would be helpful. So that's enough from me. I'm now going to start looking for raised hands. I don't know if there's somebody who'd like to go first. I know some of you have prepared slides, so I can also call you. You can unmute and start speaking, raise a hand. Break the ice. Anyone wants to go first? Aha, thank you, Elizabeth.
Okay, so since no one was starting, and since I've just sent you my slide 1 minute ago, I decided to start. So following Adelina's suggestion, I would like to give you a very fast update on free content, and I'm going to share my slide in a second. Free issue concerning the current situation in Italy. I'm okay. You should see the screen now. Is it correct?
Perfect. Thank you.
So I'm speaking from Italy, from Milan, Bocconi University, and I'm monitoring what is happening in long-term care facilities since 2020, and I'm participating to Adelina meeting. So first, where we are in terms of spread among the elderly population and long-term care facilities. It's a pity we do not have in Italy updated figures concerning the national situation and long-term care facilities in this very moment. The data stop early month of 2020 for what concerns specifically nursing home, but we have some hints concerning the overall population. So here you have 2 items, the vaccination campaign, how is it going? You see that for the elderly population, we have almost reached full coverage, first shot, 2 shot, also with the booster. In terms of how the pandemic is going this week, it's a bit better than the previous one, but still we are in the middle of the 4th wave. A lot of new cases every day. 10% are eating the elderly population, but we do not know how many of these people are residents of long-term care facilities and how many of them are at home, because we do not have the specific figure. Another topic that with Adelina, I'm sorry, still on how it is going in long-term care facilities. Here you have data only for Lombardy region, presenting what has been happening. Bottom graph, the guest of long-term care facilities, and then the death in long-term care facilities. The second graph here. So from 2020 to now, how it is going in terms of how many cases and how many isolation, and also how many deaths. You can see that even if we are in the midst of the fourth wave, the vaccination campaign, at least in Lombardy, has been working, because we have very fewer number of cases, isolation, and also death. This was for what concerned the numbers. Then another topic might be interesting comparatively is access to long-term care facilities. So also in Italy, we have been introducing the Green Pass, the 2-level Green Pass, and then what we call the Super Green Pass, where the testing is not including and only having been boosted or having been a COVID person in the past are relevant to obtain this Super Green Pass. So from beginning of this year, the only way to access long-term care facilities as a visitor is to have the Super Green Pass. As a general law, national law, but we know, since power are given locally to each long-term care manager to decide how to cope with the visitor policy, we know that half and a half the facilities are split among them that are just following the national law, and those that have been opting for more severe procedure, also, for example, asking for being tested or allowing for a limited number of visit during the week, sorry. So, or deciding for full closure. The fourth topic I'd like to focus on is the situation of the workforce shortage in long-term care facilities. We are experiencing a very bad workforce shortages in this month, starting from the end of 2021. No specific data exists for the moment. I'm participating in a research project that from the next month we'll start collecting figures and data nationally, so covering all the long-term care facilities in Italy. For the moment, we have just done a preliminary studies, a survey involving 24 public or private institutions managing long-term care facilities across the country. So what they told us, they are suffering for a crisis connected to the workforce. 100% of them, if we call about nurses, a little less if we call about GP or geriatrician, fewer crises declared in the case of other care professionals. So which is the point? The point is majority of the cases, almost 100% shortage of personnel. Then we have also the issue of having poor motivation connected with COVID-19, but not only, mainly connected with the situation of contracts and the wages level that are recognized in the long-term care sector, that similarly to other countries is very poor condition if compared to, for example, healthcare sector or public NHS. Then another topic is the burnout of the workforce after COVID-19, and then the natural impact, let's say, so natural wave of retirement or opting out for other job offers. What we have collected in terms of how many are missing. So nationally, we know that also considering the healthcare sector for the nurses, 60,000 of new professionals are in this moment missing from both NHS and long-term care sector. The one we have interviewed tell us that on average, they're missing 26% of their nurses, but some of them, they're missing the 50% and lower percentages for the other professional, but still relevant percentages. We have asked from when they're suffering of these shortages, and the average answer is 18 months. So back half 2020, and all of them agree, not all, but almost all agree that it was something that is most severe also due to COVID-19. Which are the reason? From 0 to 10, we asked to say how, if they believe that this possible reason is true and relevant for the phenomena. And the one with the higher point is the overall shortage of absence of professionals. So also with a focus on the education system in Italy. The topic here is every year we have a small number of new nurses, GP, and other care professionals. So overall, we have a shortage of professionals in the country. But also another topic is massive public hiring in the NHS due to the COVID pandemic. That is subtracting some resources from other less attractive, like the long-term care sector, that is considered not to be competitive in hiring due to the condition in the contracts and in the wages, but also in the contents of the profession that is perceived as less qualified and less interesting than the contents that are managed by nurses and geriatricians in the healthcare sector. Okay, and that's everything from me. I hope it was enough fast and enough interesting for you.
Thanks. That was a great overview, Elisabetta. I have a very quick question. I'll take advantage and ask it directly, which is whether the Green Pass also applies to staff, or is it only family visitors that have to be?
It is mandatory to have the vaccination. So yes.
Thank you.
Also administrative stuff.
Yeah. Sorry, thanks. Anyone else has questions for Elisabetta? If so, raise a hand. You can also put them on the chat, and we will be also moving towards Sweden. And thank you so much, Marta, for already being ready to go, which helps us go fast. Any questions for Elisabetta, please put them in the chat, and what we'll do is we'll pick the questions in a block maybe after we hear also from Sweden. So thank you very much, Elisabetta. Marta, all yours.
Apologies, I was a little bit too fast, but I was nervous not to be fast enough. So I didn't want to interrupt you, Elisabetta. So from Sweden, it's a very short one. This is the number of, I haven't translated the headings. This is a number of residents in care homes who have been infected by COVID-19 per week. So as you can see at the end of the slide that we have a very rapid increase now. I'm sure we had more cases in the first and second wave, but we had much less testing at the time. So we have a very rapid increase right now of Omicron, a bit later than some other European countries, but definitely we are catching up, so to say, unfortunately. And so we can also see to some extent the increase of COVID-19 death in care homes, but much less so than in the first and second wave, as you can see in this slide. Altogether, 7% of the care home residents have died from COVID-19, which in our case means that COVID-19 is mentioned in the death certificate as main or secondary cause of death. So it's not only that you were infected and died, your death is related to the infection. And the care home cases are 40% of all COVID-19 related death in the country, which is fairly similar in most countries, I think. So the vaccination rollout in Sweden has been a bit slower, I think, compared to some other countries. But this is the proportion who had got the first doses, green, and second doses, purple, and third doses or booster dose in orange. And the first 3 bars are for the residents in care homes. The second 3 bars are for users of home care. And then we have the population outside long-term care, 80 plus, and the population outside long-term care, 65 to 79. And as you can see, we have reached fairly well the care home population also with the booster doses, but less so the home care population, which is a bit of a problem because there the infection is spreading among home care users for the moment. We have not as fantastic figures for the care home staff or long-term care staff. It's not mandatory to be vaccinated in Sweden. We have no legal rules that makes that possible at all, and I don't think we would like to have it either, honestly. So, but you can see the first 3 bars are for the care home staff, the second 3 bars for the home care staff, and the third are for disability services, and the fourth 3 bars are for hospital staff. So first and second doses, 85-88% of care home staff, but the booster doses haven't reached this group at all to the same extent as the older people, which is part of a priority, because it was argued that the frail older people need the booster dose much faster than the staff, and we have had problems managing the booster doses. So we have reasonably well reached staff, but not to the same extent as one would have hoped for. So key issues of concern, I'm not entirely sure. So we definitely have lack of staff, and a bit like Elisabetta was talking about, but very much so right now because of the Omicron, because people are sick or quarantined at home. And there's definitely a worry now because of this increasing spread among long-term care users in care homes in particular, with the risk that because they are so frail, even Omicron might be too much for them. We have a problem with lacking testing capacity. We have just recently, last week, decided not to test ordinary people, but really prioritize long-term care users and staff for testing, and also healthcare staff and some other groups. So we are testing less than we did. So our figures on the spread of infection will not be comparable from this week and forward. And there is, to some extent at least, worries about resistance to vaccination among some long-term care workers, in particular in the metropolitan area where I live, in Stockholm. What I didn't put on this slide, but I think maybe I should, is that we have we are not closing care homes for family to visit. Since a year now, it's open. All care homes are open for family to visit. They are told not to come if they are ill, but they are not demanded to be vaccinated, but they are encouraged, of course. But they are asked to follow the instructions of staff, to go only directly to the room of the resident they are visiting, and to have a face mask and to wash their hands. So that is, and I must say, I think that was the worst thing we did in Sweden, was that we closed the homes for so long time. That was really a problem. So now even now, when we have this rapid spread, there is no discussion that we should close the care homes. So they are not allowed to close the care homes. So that's I'm ending there, unless there are questions.
Thank you very much, Marta. And again, a follow-up question also on visiting. If a care home decided to close, irrespective, is there any mechanism to guarantee the right of families to visit, or is that something that is just happens?
Was that to me?
Yes. So you said that there's no restriction on visiting, and that's the national policy. But are care homes able to just decide to close?
No, they are not.
And is there what is the mechanism through which this is enforced or protected? Because in many countries, what we are finding is that the care homes adopt a stricter policy than the guidance.
I'm not entirely sure whether it's still the case, but for a while it was so that if they wanted to, because they had a local spread, they had to demand a permit from the national health authorities to be able to close, and they were only allowed to close it if all other means were checked beforehand. And I'm not sure that, I think now it's even though they are not allowed to close the whole home for visits. So I think that is still the case, but I have to check that before I write it down to you, Adelina. I will check it. But it has been kind of more. I think the authorities are more aware now how important visits are, and they don't close it because because as long as you just follow the routines and wash your hands, put on a face mask, and don't come if you're ill, and go directly to the room of the residents, it's not much of a risk compared to staff, honestly.
Yeah, but you'd be amazed how different it is in different countries.
Yeah.
And I think we'll be hearing more of that. We have a question from Joel. I don't know if I pronounce your name right. Joel Mosson.
Yes, thank you. Yes, Joël. So the question is to both of you. I mean, do you have any screenings in place in national screening policies in long-term care facilities now, e.g. antigen tests regular, or do you just test on when people are symptomatic?
I don't think there is national screening of everyone every day, but now when it's so widely spread, care homes are encouraged to use antigen test to test at least a couple of weeks to make sure that they don't have an outbreak.
In Italy, we do not have any screening ongoing. You got the screening, you enter the screening mechanism only if some positive case pop up or some contact with positive case maybe from the staff pop up. But what I know is that private long-term care facility managers are buying tons of tests, as also us as private citizens are doing, to test periodically, at least the staff.
Follow-up question: who pays for the tests used in care homes? So in England, for example, they've just now decided that they'll continue funding the tests for long-term for care homes for a year and for home care. And what's the situation in Sweden and Italy?
I would say the state is funding that. I have to definitely the state is funding the PCR tests. Whether the state is also funding the rapid tests in care homes, I have to check. I think so. So it's definitely not the individual care home.
Mm-hmm. So official screening are the local health authorities paying for that. So the state, since the state cover long-term care expenditure in Italy.
Thank you very much. So I think we might be going to Austria next, and I know we've got Kai, and I've seen, I think maybe Andrea Schmidt is also here. If you're here, between the two of you, I think you can cover it together, and other colleagues also who are based in Austria, feel free to raise hands and contribute.
Yeah, just two things from my side, and then Andrea can complement. Well, Austria, as you know, is a test champion in especially Vienna. This is fully free and fully funded. Publicly funded, so well, there are some gaps, of course, in the regions, but in Vienna, it's I think Vienna alone is doing more tests per day than Germany. However, we have one problem in care homes with staff, as also in other countries. Only 75% are vaccinated, and this is a bit reflecting the whole population. This Austrian characteristics of 24-hour carers, there we have the problem now that live-in migrant carers coming from Eastern Europe often have vaccination with other vaccines that are not acknowledged in the EU, while we are, I think, also the first country to have a compulsory vaccination from, when is it, 1st March onwards. So this will be then another bottleneck with the 24-hour carers, but also with the care workers, because if there are only 75% now, the question is whether they will get vaccinated or leave the job, and this will further contribute to the lack of personnel that we have, as all other countries too. There is one, this would be interesting to know, there is one discussion in Austria, well, how to get over the lack of personnel. One proposal is to introduce something like a what is it, after at 14, 15, to start an apprenticeship program for care workers. And there is a huge discussion because experts say, well, this is not really helping because, well, at this young age to go into long-term care doesn't make sense. But still there are political forces that want to introduce this as one of the issues. Thanks.
Thank you very much, Kai. And I don't know if Andrea, Stefania, others based in Austria would like to add anything. I'm not sure I've seen. No? Okay. So we've got a few other countries to go to. Any questions for Kai before we move?
Is there any country that has such an apprenticeship program?
I haven't really seen anything, but there is there are reports, for example, from Australia, where they were trying to encourage students, and it didn't work so well.
Yeah, no, in Switzerland, it seems to, not really work, because there's a lot of exit then after this apprenticeship.
Yeah. So in what I was reading.
Sorry, the Conservative parties in Germany have been proposing this forever, and we don't believe that it will make a positive impact. So the sector is very much opposed.
Yeah.
Yeah, the experiences from Australia suggest that they're recruiting all these people to kind of help the care homes, but the care homes find it's more troublesome to bring them in than to actually keep doing things with fewer people, which is interesting. So we next go to Malta, and
hello,
Maria
hi.
Aurora, you're ready.
Hi. Can you hear me? Okay, I'm fine.
Yeah, thank you.
So the situation, quite honestly, is a bit frustrating. In fact, I wasn't really sure whether to speak or not, but then I plugged up my courage, having heard my colleagues over here. So it's been really an uphill struggle to get some data with respect to care homes. And even now, I still don't have the data. I might be edging closer to having this data, but it seems, like I said last time, that the data is concealed Fort Knox situation kind of thing. Unfortunately, just before Christmas, Omicron started creeping in, and the deaths don't look too good. So from the 1st January until today, 56 older persons died from the 60 deaths. So we registered 60 deaths. 56 of those were older persons from 60 to 97 years of age. We are not aware whether they were vaccinated. We're not aware whether they were from the community or whether they were from care homes. None of this data, I'm not privy to any of the data. I spoke with the director of the largest institute in Malta, which caters for 1,500 older persons. But she told me in no uncertain terms that I will not be able to access the data. So that's that. I'll be trying other avenues. I haven't given up yet. I'll be trying other avenues. So with respect to the situation of staff in Malta, during the pandemic, we lost a considerable number of human resource, mainly the foreign workers. And basically, they all moved to the UK post-Brexit because the pays were better. And last 2 weeks ago, because all the information that I seem to be getting is from the media, from the journals, from the local papers. So basically, the private sector for care homes got together, and they've been tapping the local government, telling them that unless something is done with urgency, the situation within the care homes is in dire straits with respect to human resources. So there's no staff are not obliged to get the vaccine, and they can still work within the care home even though they're not vaccinated. However, visitors, if they're not vaccinated, they have to visit the older person in the foyer. They're not allowed to go in the older person's room, which is a cliche really. So the staff member can go in and see to the care needs of the older person, but the relative cannot. So with respect to screening, I honestly don't know what's happening. We're still in Malta, it's illegal to have the self-testing kits. So there, we can't have them, it's illegal. I know that there are companies, black market, what do you call them, who are these large private companies who are testing their employees to ensure that they have enough employees on the floor, because a lot of employees were getting infected between Christmas and today. But public health authorities have said that they are aware of these testing kits, but that they can't do much about it. But we have to book a test. So we usually book a test with the local government, but the waiting list is a month long. So we have to resort to the private sector. And that would cost us some €145 to book the test, but at least we'll get the test on the same day or the next day, but we'll have to fork out €150 to get the test done. But the self-testing kits or whatever, I mean, my daughter is studying in the UK, and she just before every day that she goes to university, she's got to self-test herself, and I've seen them, I mean, when we talk, but we're not allowed to have them in Malta. So I don't know what care homes are doing. Most probably they are resorting to testing if the older person is coming up with symptoms. But last week we got to know that care homes, successive respective management have taken to mitigating on their own steam. So last week there was this older person who established some contact with one of the local papers. He regarded himself, and he said that he would be going on hunger strike because he's been constrained in his room since before Christmas, and this was 5 days ago. We weren't aware that care homes were in lockdown. So then other older persons started speaking up, and I realized that respective care homes were in lockdown. So the local government was saying one thing, but the care homes were doing the opposite. So now you can imagine, you can understand why data is I'm not so privy to the data, but it's very frustrating. Now we've been advised yesterday that the local government this week will be easing down restrictions, if you can call that we have any restrictions. The only restriction that we have is to have a green pass. We have to be vaccinated to go to a local restaurant, and we have to wear a mask outside if we are in a group of more than 2 people. So I don't know what the restrictions really and truly. And roughly 75% of the population has had the 3rd dose as of this week. So basically, in summary, that's Malta.
Thank you very much,
Thank you.
Maria Aurora. And I was just noticing a question from Elisabetta, whether Italy had the strictest visiting regime, but I don't know. It's not a very happy competition, I have to say. Do hope things get better, and at this stage, it sounds like thank goodness for the press. It's difficult to do research in this situation, and I really appreciate your efforts to share with us the little information that you can find.
It's as though I'm flogging a dead horse.
Thank you. So we next go to Luxembourg, and Joe, if you want to try, see if you can share your slides. Thank you. we can see them. Thank you, but I can't hear you yet.
That's better.
Thank you.
So I work at the Ministry of Health, and we have this essentially this bi-monthly meeting where we discuss the figures with the partners from the Ministry of Family Affairs and also with representatives of the sectors. So this essentially is the slide of the incidences that you might have seen before also from other countries, where you look at where do we stand now compared to the peak we had in October or in autumn of 2020, and the blue line essentially shows the kind of, you can see the decoupling essentially going on between the cases, the hospitalizations, and the intensive care and deaths, which have been constant, where we've seen really since Christmas, actually the week before Christmas, cases have been going up really highly because of Omicron. In terms of age groups, what we see is that initially the Omicron wave hit earlier younger age groups, particularly 15 to 20 and 29-year-olds, but now it's kind of edging up in all age groups. And in the last 2 weeks, we also see now quite large outbreaks in nursing homes. This is essentially where we compared the number of cases in personnel and residents in the nursing homes. And what we saw before was that we had more cases among residents than among personnel. Since for quite a while we actually seen the opposite. We see more cases in personnel and staff, although in the past week I think these numbers probably will join. We see as many cases in residents than we see in staff. So we've been calling some of the homes that have seen outbreaks, and the people there have been quite relaxed, which is kind of surprising because most of the cases in nursing home residents have been very mild. We have a kind of a vaccination rate of about 96% in residents. It's really high, and almost all of these have also received the booster. So we've seen really mild cases, and it's been, and this is actually seen when you look at the evolution of hospitalization and deaths. We haven't really seen any deaths or hardly any hospitalizations. Often hospitalizations have been incidentals, meaning that the cases have been to hospital for other reasons and were tested positive. So we're really seeing a kind of really mild epidemic going on in the nursing homes, and the field. And the feedback from the field is that the residents don't often understand why they're being held in isolation or in quarantine, because they have nothing or very, at most, a mild fever or headaches. So it's really kind of, and for us at the Ministry of Health, it's been kind of important to kind of accompany also the sector in trying not to be too restrictive in the isolation and quarantines, but actually provide still a really helpful living environment for the older persons, because currently there isn't really a major health threat ongoing. And finally, we also have just our comparison with other countries, where we're still in terms of a little bit lower than other countries, but this slide hasn't been updated also for a few weeks. I think we are now kind of joining other countries.
Thank you very much for this update. And there's a new paper, actually, I'll put the link later, from a study in England called the Vivaldi study, looking at cases and deaths through the different waves in the UK. It's also been able to look at the impact of vaccination. And they have the first study out on Omicron today as a preprint in meta-archive. And they also found, as your data was showing, a much lower severity impact of Omicron compared to previous variant. I think the hospitalization, whereas before we had about 10% of cases would go into a hospital among care home residents, their estimate now is about 4% under Omicron and again, also much lower impact in mortality. So this tension between the measures and the severity are playing out, as we can see in a lot of countries, and it seems to me that there's some adjustment that needs to be made. Sounds like countries like Sweden have embraced that more rapidly than Italy and Malta and other places, and of course there are a lot of differences. So I'm going to actually take advantage just one moment before we go to the US. I'd like to introduce you to mention one thing I forgot to say at the beginning. And as you know, at the beginning of the pandemic and until January 21, we were collecting data on mortality. We kind of stopped thinking, oh, this is all going to be over, and also getting busy with other things. But we are working to collect that data again, but we're also trying to do it in a different way. So we are going to integrate with, I don't know if you're familiar with Tableau Public, which is a way of displaying data in websites. It's a bit more agile than the reports we were producing earlier. And I'd like to invite my colleague Disha Patel to briefly unmute, because she'll be getting in touch with many of you to ask for help updating the data. So there are some countries where we can easily get it from the Ministry of Health, and it's relatively straightforward for us to pick it up and put it on the website. In other countries, it's a lot more complicated, and we will need your help. So I'd just like to invite Disha to say hello, and look out for an email from her probably. So Disha.
Hi everyone. Yeah, I'm currently gathering the mortality data across some of the countries for which we had data previously to try and update it so that we can have some nice updated figures that we can share, looking at mortality like a snapshot, but also looking at how it has evolved over time within long-term care populations versus the community population. So I will definitely be reaching out to a number of you because gathering the data is proving challenging.
Thank you very much. And we have also found that countries have changed the way in which they collect data through the period. And as we know, it's all very complex. And in fact, Greg, I think you're going to go next, and you are very familiar with the difficulties of getting data on countries. So Greg, if you're ready to go now on the US.
Sure, thank you. Let me try to share my screen here.
That's great.
Slideshow. Can people see that?
Yes, we can see it. Thank you.
Okay. We've been tracking COVID-19 cases and mortality, both in nursing homes and in non-nursing home settings. This presents data on new cases and deaths, both in the nursing home and in the non-nursing home or the community setting. The reporting periods are from May 31st, 2020, the start, the earliest week that we have data available. And then it's up through January 9th, which we downloaded that data on Thursday of last week. Those are the two sources for the data. The non-nursing home or community cases are total cases minus the nursing home. Now, a really important point here is that the nursing homes or nursing facilities are certified. They provide nursing care in the US. And there are other residential care settings, assisted living, personal care homes, memory centers that are not included in the data that we have. The data are being collected by the Center for Medicare and Medicaid Services, and they're for nursing homes only. And that's a really important point because we still have the older people in the US accounting for the lion's share of deaths. And a lot of them are not in the nursing home setting, and they have not been for several months now. So let me start with the slides. This shows you the patterns. Let me got to minimize this so I can see them myself. This is the pattern that was observed in Sweden and in Luxembourg, and this slide's there, and it's probably all over East European countries in the US. There's been a considerable spike lately in cases in the last 3 to 4 weeks, and this understates that spike. I think it's really interesting here how closely the staff and the resident cases follow each other. And the patterns, essentially, this pattern is indicative of two things. One, it's probably indicative of the spread that can be attributed to the staff coming down with COVID, maybe outside the nursing home setting and bringing it into the setting. The second situation is the staff shortages. And I'll show you a slide at the very end that reports on staff shortages. But certainly when staff members come down with COVID, they're going to be quarantining and there'll be a shortage, contribute to the shortage. So if we move forward here, let me see. Oh. Okay, this shows the, let's see, I'm getting all kinds of stuff on the screen here. This shows the staff and the community new cases. And this is a pattern here where obviously what happens in the community gets transmitted into the nursing home by way of staff and by way of residents, resident cases. Oh, gosh. In this case, we saw the cases. Now these are the figures on nursing home deaths, resident deaths, and you can see this dramatic drop, and that was present in the other slides as well. That's essentially when vaccinations were introduced, and it's just incredible the impact that vaccination, the uptake of vaccinations occurred between December and February, and that it's incredible the impact that it had on reducing mortality. We have an uptake, some degree of an uptake in mortality very recently, and as you know, the mortality figures will lag behind the hospitalizations and the cases. So we're going to look very closely, and I guess everyone all over the world needs to look very closely over the next few weeks to see what the impact of Omicron is on the mortality figures, both in nursing homes and in long-term care settings. This shows you the weekly nursing home resident and community deaths, the patterns together. And you can see that the nursing home and the community mortality patterns were very similar up until December of 2021 and January of 20 and January of 21. At that point is when the vaccinations were introduced. The vaccination rate in nursing homes is extremely high, in the high 80s, perhaps 90. It's hard to get exact figures. But the vaccination rate in the community, on the other hand, is considerably lower. There's been a lot of resistance, as you probably know, in the United States to vaccinations. And you can see that these community patterns of mortality have continued, and the nursing home patterns have basically flattened. Finally, here's the slide showing the reported staff shortages. And at the last few weeks, the last 3 or 4 weeks, there's been quite a surge in shortages, although shortages have been reported all along since the very beginning. And as you would imagine, the highest reported shortages have been among nursing staff and among aides. And you can, those are the top two lines on the graph. A really important caveat is these figures are being reported directly to the Center for Medicare and Medicaid Services. And the facilities run the risk potentially of a quality of care citation, a violation, if they have inadequate staffing. So there's a potential bias here not to report a staffing shortage to the regulators. And that maybe accounts for this lower figure, which is, approaching 30%, but still what we hear in the media and with the training of military to go into nursing homes and start providing care. I mean, there's probably the staffing shortage in the US is probably considerably higher than what these data suggest. I think, in terms of issues, we really have to deal with the fundamental structural problems of nursing homes. And it was tough. It has been tough to do that under circumstances of crisis. And if we can ever get this stabilized and get COVID under control, then we really need to make the changes, structural changes with regard to the labor force, the transitions between care settings, all the different issues that cut across and which countries and which are basic to preparing for a pandemic in the future.
Thank you very much, Greg. Thank you, Greg. I would like to have that data. So I just put in that chat, responding to a question from Kai as well. We have now started a section, and it's so new that it's only got a little bit of something for 3 countries, as we started it, I think, on Friday, trying to collect data on shortages and just trying to see if we can see some similarities or raise maybe by bringing different examples together, try and raise a bit more attention to this topic. There's one thing, Greg, I don't know, I'm sorry to put you on the spot. It may be something you don't know much about, you haven't heard much about, but I understand that in Minnesota, they've been training National Guard during the summer, so for going into care homes. And I just wondered where they've been deployed, and if so, if there's any idea of whether that's working or not. My understanding is that they undertook formal training. So National Guard members took formal training to be care assistants. And I just wondered if you know anything about how that's worked in practice.
You want my cynical answer or my
any answer? This is being recorded.
No, I think this is just a sign of the desperation. On the one hand, these extreme shortages of staff caused by staff being, ill or not wanting to work in nursing homes, losing staff. And secondly, what are governments going to do? Well, they got the military at their control, so they can just get the military out there. They're doing the same thing with hospitals, and they have been deployed, but I mean, just sending somebody into a nursing home and then filling in. I mean, it's a short-term activity. I think in Minnesota, the last I saw, there were maybe 30 or 40 cases, staff, military people, but they may have introduced more. I don't know. Hopefully we can, what was said earlier, this is hopefully a mild case. Omicron is more mild. It's not going to lead to the same severity. We're going to work our way out of it and get back to some degree of normalcy, and then we'll have to really learn how to staff our nursing homes adequately and have that reserve there when we need it.
Thank you, Greg. And I see that we've got we've got 2 hands. Joel, if that's okay, I will go first to Nerina because she's also based in the US, so she may have something to add to this, and then we'll come to your question. Hi, Nerina.
Hi, thank you. No, I just wanted to add to what Greg said about the National Guard. So they have been deployed not only in Minnesota, but also in other states. And like it was mentioned earlier, it's only meant to be a short-term solution. They have been trained to do not only bedside care, but also other roles like being dietary staff in the kitchen, for example, or housekeepers, just to augment staffing in nursing homes. It's not a permanent solution, but I live in California, so I know that and I work in the long-term care industry, so I know for a fact that that has helped. Their presence, have helped, but it has also been quite intimidating to the staff who work there. And just to speak about how bad the staffing shortages, and I don't know if you're aware, but the CDC has recently changed their quarantine and isolation guidelines for healthcare personnel so that, if you're asymptomatic and you're positive and you're willing to work, you can come to work. You don't need to be tested. You don't need to quarantine anymore. So that's how bad it is right now.
Okay, thank you. And Joel, I don't know if you still like to come in.
Yeah, it's just about the staff shortages in general, because we are keeping track of different sectors, not just the long-term care facility sector. So we can really see which sectors are currently actually most suffering from the isolation rules in particular, not just quarantine, but the isolation. And surprisingly, the long-term care facility, at least in Luxembourg, is not one which is having a lot of shortages. And we don't get feedback from the industry. There's where we see much more shortages is in the care of young persons, creches. That's where the epidemic is currently occurring, and where we see much higher rates in staff in those. It's actually, and the same is true for hospital. It's not so high. It's currently the epidemic is among young persons and the people also in schools, fundamental schools. A lot of teachers are sick or are positive. Let's put it that way.
Thank you very much. Thank you. I don't know if there are other. Feel free to keep using the chat. I think to make sure we have enough time, we'll just keep moving because we have more countries to cover. And next, I think is we're going to Germany. So Thomas, if you're ready.
Hi, Adelina. Thank you. If I'm seeming a bit distracted, we've just had news that there was a shooting at the medical faculty in Heidelberg, which is quite shocking, and we're still hoping that nothing too bad has happened, really. So nursing shortages or shortages in care homes and nursing homes, we don't know really much about it because we don't monitor that properly. But I would really want to stress what was just said in the chat by Elisabetta, that we really have two phenomena here that overlap. And I think that's probably true for all our countries. There is a debate about the vaccine mandate that will become effective in March, and those who oppose vaccination try to scare us into believing that lots of staff will leave the sector by March. And maybe a fact to know, on the weekend, we saw a massive fake news campaign from that side with classified ads in various free circulating papers across the country advertising nurses who or trying to present as nurses looking for new jobs. Journalists follow those up. These were all fake ads. So this is really concerning here. We don't know really what's going to happen. And I would love to tell you what the real rates of vaccinations are in care homes and in nursing homes, but we're not really sure because the system doesn't report that properly, even though we have a mandatory reporting system in place since December. These data are not available. And what I hear is that the local health authorities just don't work with them. They end up, care homes have to send in the data on paper, and that's where it ends. So we don't know. We know from a study, an ongoing study by our National Health Authority, that we probably have a large variation in vaccination, between 20% in some care homes and 100% in many others. And that is both true for staff and for residents. As care homes and people who need care have not been prioritized for the third dose, they're really competing with everyone else. So we're probably not where we would like to be in terms of vaccinations. On the other hand, looking at the data that was just presented from other countries, I think Omicron has probably not hit the long-term care population yet. So last week we had a maximum of 110,000 new cases across the country on one day. But for the whole week, only 1,627 new cases were reported in residential care facilities. So apparently there's a disconnect, which would be wonderful. It's going to be interesting to see if we can maintain this level of separation of the long-term care population. We don't know anything about the people who need care, who are cared for at home, even though that's the majority of them, but we don't have proper data on them because it's not being reported. Care homes, because we've talked about access, we basically have a green pass regulation, but you can also access the care home with a negative rapid test. And that has been a national mandate since December, where before that was up to the local or the state authorities and to local authorities. And I think that's pretty much what I can say right now about the situation. My problem, or our problem here, is really that the data we get from the sector is really poor and the mechanisms do not get improved. And our big grievance right now is that even new expert panels that are supposed to support the federal government are composed without any expertise in nursing, in long-term care, or in geriatrics. And the government answer to that was, well, we only wanted a limited number of experts, and 19 was the maximum we could get. So I saw that letter because, well, so 19 seems to be the magical number. And if nursing and long-term care is expert number 20, it's not on the panel that advises the government. So there you go.
That sounds quite familiar in many countries, unfortunately. Thank you, Thomas. So we've got, next we're going to Japan. I think we'll leave questions now till the end because we've got quite a few more to contribute. And I'm delighted to welcome Margarita Estevez Ave. Hi, Margarita.
Hi. So Adelina just told me in the chat to say a few things about sort of Japan. So I don't have any slides. So sort of just say something sort of general about Japan and what's happening with sort of Omicron, because Japanese case is just the opposite of Sweden. So Japan has always used lockdowns of nursing homes to cope with contagious diseases like the flu. So the system was in place. Nursing homes don't need to get any approval from health authorities to lock down. So most of them were in lockdown when the COVID first arrived. And as a sort of routine, during the flu season, just many people wear face masks. They are just very emphatic about hand hygiene. So without really doing anything special for COVID-19, they have fared sort of quite well during the first phase. Omicron is just creating a new situation in a sense in Japan because they have been able to cope really well. So they have carried out vaccines, but they have been very slow in the booster. because the number of deaths has just never skyrocketed. They have just fared really well. So this Omicron, now, again, some nursing homes have just already going to lockdowns. They're just only now just doing boosters, even with medical personnel. So now there is a bit of a race against time. And they have just resumed weekly testing at nursing home facilities, because they thought that they was already over. Now, this kind of sort of confidence that they have dealt with the COVID-19 fairly well, they were scaling back all the efforts, like sort of testing. They just felt, okay, so we just vaccinated everyone. We just never had high rates of mortality. So now we can kind of relax back. So now they're just bringing those measures back again. And one problem with the Japanese case is that there's no central, the government doesn't make public the mortality rates in nursing homes. There's no data on the breakdown on the death of residents, nor of the staff. So there are private efforts to keep track of these numbers. But in terms of public authoritative sort of data, that has been just lacking in the Japanese case. So I'll just stop here, and I'll have to just disappear in a while. I'm just teaching. I'm just using, this is in between two of my classes. So soon I will just disappear, but just very nice to see you and hear all the country reports. I really appreciate that.
Thank you, Margarita. And I'm sure we'll be hearing more from you in the future too. It's great you could join us. So next we're going to go to England, and Nina is going to give, Nina Hemmings from NAFLD has a very brief update. I think you're going to focus on workforce.
Yeah, thank you, Adelina. And hi, everyone. My name's Nina. I'm a researcher at the Nuffield Trust, which is a think tank in England. And I've been working with Adelina and others on a bigger project looking at social care resilience and recovery. So everything you've been saying has been really helpful for informing our research on that. And I'm largely going to focus on the adult social care workforce, because that's probably the policy area I've been looking at most closely recently. And I haven't prepared any slides, but I will show you just a couple of graphs that I think might be quite interesting. Let me just find where the share screen is. Okay, can you see this chart in front of you?
Yes. Yes.
Great, thank you. So this is some data that I looked at actually last year, just before the mandatory vaccination requirement kicked in for care home staff in England. And it is a little bit dated now, but it was essentially showing that since the introduction of the requirement, the percentage or proportion of care home staff who did follow through and get 2 doses of the vaccine had increased. So just before the milestone kicked in, about 1/10 of that workforce hadn't been vaccinated. So I think there had been an uptick in the proportion of staff receiving their dose. However, I think arguably as a result of that, data that one of my colleagues at Nuffield has been looking at indicates quite a hit to the number of staff working in the workforce as a total, and that's across different settings. So one important thing to note is that the requirement currently is for staff in care homes to receive the vaccine, and as of, I think it's April of this year, that requirement will extend to staff in all other settings, so home care workers, people who are personal assistants working in people's own homes. And essentially what this data is showing that is between spring and autumn of last year, the number of staff deployed in social care settings fell by, we estimate, around 42,000, although because of issues with the data, that figure could actually be as high as 70,000. And as you'd expect, care providers are quite rightly really concerned with the loss of staff as a result. What we're now starting to see is protests from NHS workers who, as of April, will also be required to have the vaccine. And there seems to be a little bit of movement with some rumours that that requirement might be delayed, especially given the sort of political turmoil that's set the backdrop for the start of this year. Let me just stop sharing screen. So that's the context that we find ourselves in. And perhaps similarly to what Greg was mentioning earlier about some of the parallels, we've heard about local authorities having to draft in members of the military to plug workforce shortages, or to pull in other public sector workforces, such as librarians. So local authorities and employers are really scrabbling, and that's even with government funding recently being pledged. So they received something like £460 million last year in 2 tranches, and a further 60 million in January of this year to try and help employers grapple with these workforce shortages. The extent to which that will help is still playing out. And we're seeing some of the consequences of that also in things like delayed discharges from hospital, where the latest data seem to be showing that just under 1/3 of all those patients who are deemed medically ready, medically safe to be discharged, and less than 1/3 of those were able to go home or to a care home or another setting to recover because of a shortage of social care staff in the community. And then I guess a small point on visiting, because people have mentioned that earlier. At the moment in England, if there are 2 positive cases in a care home, and that can be staff or residents, it means that the entire care home is locked down for 14 days, so 2 weeks. And in a hypothetical scenario where, say, 13 days in, another person tests positive, that means the care home will extend for another 14 days. And it means that some people haven't been able to see their relatives since before Christmas. And this is obviously really worrying given what we know about the well-being of care home residents and the importance of visiting rights. I'll end on a positive note. So Adelina mentioned earlier that funding for testing and PPE has been continued. So the government are continuing to fund that and will do so for another year. But really it is the workforce challenges that are causing the most consternation. And yeah, it'd be great to hear about any solutions in your countries that seem to be working, or things that providers are doing that seem to make a difference. Thanks.
Thanks, Nina. There's a question that you can maybe answer it in the chat, which is something that other countries can do and the UK can't. I'll just leave that there. Going to France, to Camille, you want to give us a quick update? And I understand France has done some things to make working in this sector a bit more attractive than maybe in the UK.
Yeah, thanks, Adelina. And I'm sorry, my internet's a bit wobbly, so if I break up, I'm really sorry, and just let me know and I'll switch my camera off. But just an update on the current situation. So at the moment, you might have seen in the news that France has got very high case numbers. So on average, it's 360,000 cases per day, and it was as high as almost 500,000. I think it was last week. 500,000 last week. But the situation doesn't seem to have unfolded too badly in care homes. So there's quite a high level of booster coverage, both among residents and among staff. So it was 66.9% of residents had their booster dose as of 2 days ago. And I'm just find the numbers for, sorry, 66.9% of staff had their booster dose, and 69.9% of residents had their booster dose. But one thing to note in France is that there is mandatory vaccines for staff, so that's all health and care staff. And as of Friday, that staff will be required to have all 3 vaccinations in order to be able to continue to exert in the sector. So there might be some pressures coming, as you know, it's almost 1/3 of workers who might not be able to work. But it's quite difficult to disentangle between the mandatory obligations for staff to be vaccinated and the fact that they've also introduced, so as of last summer, a health pass, which is where in order to access things like cinemas and bars and restaurants, you had to have either a negative test or a full vaccination cycle. That's now changed, so it's only open to vaccination. So it's difficult to tell what's been the bigger push between the obligation for staff and then the wider kind of societal measures. In terms of visiting, there haven't been any changes as a result of Omicron. So you can visit without kind of booking or making an appointment, but it is conditional on presentation of the vaccine pass, and regular testing is encouraged. And you're also encouraged to test if you've been away from the care home for a period of time, for example, over Christmas. And care homes can temporarily close in the event of clusters. So we have seen that in some areas recently because of the impact of Omicron, but there have been much fewer deaths and hospitalizations compared to previous waves. So I think over the last week of December, it was 44 deaths in care homes compared to much higher numbers in previous waves. The biggest concern that we have heard from other countries, as we have heard from other countries, is on staff who are isolating. So that has been rising, and there is a big challenge around that. I think, but I'm not entirely sure, I need to double check this, that there was a rule that changed in the beginning of January to say that if you were asymptomatic and positive, you'd still be able to work in your care home, but I need to double check that. There have been some wider changes that have resulted as part of wider reforms as part of the pandemic. So there's been a change to salary structures, so increases to an extra €183 per month for care home staff, and also an increase in home care for up to 13 to 15%. So that's kind of in a wider perspective of trying to improve attractiveness of roles in care. But there are also some challenges with that. So there was a strike last week for care home staff that aren't on the front line because the changes to salary bands haven't been implemented everywhere in the same way. So there are strikes as a result of that. So it'll be interesting to see what that does in the long term in terms of kind of improving the attractiveness of care roles and making sure that services remain sustainable. I'll stop there.
Thank you so much, Camille. And I see also the chat active. We've got that I'm aware of 2 more speaker countries. So next we go to Norway, and after that we'll go to Spain. So we're going north to south in Europe, of course. Thanks, brother. We can see. Maybe we can project. Yeah.
Yeah, no, I unmuted as well. So I'll try again. Is it easy to see?
We can see it. I mean, there's something extra that we don't need, but maybe good enough.
Yeah. Okay, so we'll try. So thank you. Yeah, so I'm so happy to listen to those great presentations and get this very useful comparative perspective from you all regarding Norway. The present Omicron situation. We have the same situation as most of you, with a higher infection rate than ever in the general population, but hospitalization and especially use of intensive care is sharply reduced. So right now, in our country of approximately 5.4 million people, we are a tiny country. So approximately 80% of our population is vaccinated, has got at least 1 shot, and also at the present time, more than 10% of our population tested positive. the death toll is high, but not maybe not very much so in a comparative perspective. It's a bit more than 1,400 persons died as yet. Anyhow, the nursing homes residents may still be vulnerable as to serious illness and death, although some international research findings happily suggests less than before. As to end of November 2021, higher infection rates in nursing homes than ever were reporting during the pandemic. But that was at a particular time where both the Delta virus and the Omicron were concurrent and both very much present in the nursing homes. With death toll back for a while, approximately the same rate as early in the pandemic, approximately 50% of the total population, with 1% approximately of the residents died because of the pandemic. Still, the situation is like before, with huge variation between nursing homes. Earlier findings covering the first year of the pandemic, we found that the 10% nursing homes most affected by the pandemic accounted for around 40% of the nursing home deaths. And we are working now at trying to discover what factors were most important, single them out as mostly severely hit. It seems at least that the architecture and the buildings play a role, and also how people are, I mean, the working conditions of the staff, how many are, or how big a fraction of the workforce are in small and non-permanent positions. Presently, a staff shortage both in nursing homes and home-based care that we increasingly experience are mainly due to, like several of the others of you pointed out, quarantine, but also, in our case at least, less recruitment to positions in healthcare. So really the COVID situation and also the news coverage of also dire working conditions of some of the healthcare staff has played a role. So there seems to be less recruitment to those services now. Hopefully that will change again, but presently this I think is a serious situation. A few municipalities have started because of this particularly last month change where having enough staff is a big problem, have started to recruit people with a hotel background. So that's something totally new happening. They are hired for helping out with practical tasks not involving direct patient care. And we haven't received reports yet about the extent of this and how this is working. There are presently stricter rules in long-term care institutions as to quarantines because of the Omicron variant. But all nursing homes, like in Sweden, all our nursing homes are still open to visitors. But the stricter rules now states that 10 days quarantine if household members or other people close to you tested positive. But you can stop quarantine earlier if negative test, but not earlier than 7 days. And with the exceptions, if COVID-19 latest 3 months or minimum 7 days after third vaccine. We have a problem of unvaccinated staff. I think it's slightly more than 5% is the latest number I heard. So it's a problem, but it's a lesser problem maybe in some other countries. It seems like presently there is not too much opposition to vaccination in our countries. We have some public protests, but not very big. Unvaccinated staff, like in Sweden, they are keeping their jobs, but municipalities encouraged to find solutions so that they are not in direct contact with unvaccinated or particularly vulnerable, frail elderly. That's it.
Thank you very much, Frode. And we're going to go to Spain, and I think Sara Ulla is going to speak.
Yes, thank you. I'm gonna try to share my presentation. I'll be brief. I know we have not a lot of time. Can you see my presentation?
Yes, I think maybe you can project it so we see it a bit better. Yes, perfect.
There we go.
Perfect.
Okay, well, I'll be quick just for a little update on the situation. Around in November or so, early December, we had pretty good information. I mean, pretty good data, pretty low, but then we had this Omicron wave and it just went pretty high. We manage daily data, these two projections, daily data from the Ministry of Health, and then weekly report for older people, residents for long-term facilities. And this is what I'm going to do a little update very quickly. For total population, just 1 second precisely. Okay, for total population here, you can see a pretty high wall. And early December, and fortunately we're coming down. The good thing about this Omicron, as in other countries, is that symptoms are much lower. So it's much more similar to a flu. There are a lot of people asymptomatic, and that's also a problem for detection. But in terms of health, it's much better, of course. And long-term care facilities, we also see here up in blue, we see a clear increase in infections. Fortunately, the deaths are much lower in relation to other waves, but still you can see that's pretty low, that we have not. In the previous one, let me go to the previous one. It seems that we have already reached the top and we're coming down, which is pretty good. But the good thing is that, I mean, interestingly, in terms of age, the plus, hold on, because I'm seeing all sorts of things on the screen. Here we are. The 60 to 79, more than 70, more than 80. Here are these curves that we have down here. So even though you can see that in the upper graphic that it's almost a wall, these coming up of the incidence, and we're coming down, but these groups are much lower, which is quite positive in older people. And something that we think it's clear an asset and has been something to protect is the vaccination, which in Spain is very high. In people older than 70, these are the data with the booster, with third doses, is more than 91%, in more than 70, almost 90%, and more than 50, almost 80, and more than 40, 60, and 69. This is the more than 40 is currently in process of taking booster. So that's something that's very, very positive. I just want to make a last comment in terms of the restriction of the staff. I do not have the data right now because their data in social services and long-term care facilities depend. The competence belongs to the autonomous communities. So there's some difference in terms of policy and restrictions and staff and also some difficulties for data gathering, not for incidents, that's very systematic, but for other data in relation of staff or some other data that we need to analyze. It's not so quick, the data gathering. But very interestingly, in December, something that can be interesting for you, there's a council that gathers together to the general administration with all the territorial administrations, and they put together, they sit at the same table, and they made an agreement of open, relax a little bit the criteria for contracting people for long-term care facilities, to make sure that they could recruit social care staff and adapt to this Omicron wave. And in terms of, as long as they could ensure the experience, there could be some relaxation in terms of the degree that they had to do or the number of years of experience. And there was an agreement. That's what's letting us provide the service, because as other countries have mentioned before, that's been really a challenge. Just a last remark, and somebody, Lourdes, put that before on the chat. I don't know if you had the opportunity to read it, is that in terms of testing and locking down, when a person gets to his house or to their family house or something like that, and they leave their residence for a few days, they have to test negative when they come back. And even in that cases, sometimes in some communities, they have to stay in a short quarantine for a few days to make sure that there's an outbreak in the facility. I think I'm gonna leave it there right now. Thank you.
Thank you very much. And we've got 3 minutes if anybody's got a quick burning point or a question. I think, Sarah, you can stop sharing if you.
That's what I'm trying.
Sorry. And yeah, I don't see any hands at the moment, but if anybody's got any quick last points, feel free to unmute. And I am wondering whether we should have a similar meeting in about a month to see how the situation is. Would that sound interesting? Yeah, okay, I see some nodding heads. I might, given how much interest there was and how we just almost didn't make it in time, I may have a sort of more structured running order. At this case, I just wasn't sure how many people would be interested and how much things are changing. But it looks to me like workforce is a huge issue. These dual factors of the coincidence of the people having to quarantine and the structural issues with recruitment seem to be coming together. Less severity, but still in some countries, significant increases in number of deaths. So obviously something to monitor. Any information you'd like to share, please let me know. If you shared slides and you could email them to me and you haven't done it already, I'll be very grateful. And I may follow up with some of you to try and get a bit more information that we can then pick up and put in the report. In the meantime, I'd just like to wish you good luck with this Omicron. I hope it's not affecting you personally too much. And I look forward to continuing to hear from you. Thank you very much. Enjoy the rest of your day. Bye.